talk about TMJ. So I've been in practice since '08, and I've treated TMJ this entire time. Prior to getting our new therapies in the office with shockwave and laser, I used to treat TMJ with muscle work, and some at-home exercises and adjustments. I still do those things for TMJ, but adding in shockwave and laser has been a real game changer for that issue. The way TMJ works is it really affects the muscles that we use to do the chewing. So everybody tends to think about the muscles in the jaw, the masseter muscle, and around the cheek. And while we do address that, and I find that we have really good results with using shockwave in that area. So we use it from cheekbone below out and towards the ear, and we keep it really superficial. Some people have some sensitivity around their teeth, and we have a few tricks to help with that issue. And then there is another muscle that gets really irritated with TMJ, and it's the temporalis. So it's this larger muscle on the side of the head in the hairline above the ear. Lots of people will have trigger points in this area and not even realize that it's sore. When I have people in the office and when I palpate in that area, they are usually surprised that that is a sore area. And it is, if you put your hands right, your fingertips right above your ear and clench your teeth, you're going to feel that muscle move and you'll see how it's connected with clenching. It's really important to treat that muscle as well. We do some at-home exercises that we have people do for that muscle. And then we also treat that muscle with laser therapy because we cannot treat it with shockwave. So we use the laser and it really helps reduce that inflammation that's caused by chronic clenching and grinding. So people tend to be aware of if they grind their teeth because people will tell them, their dentist will tell them, maybe their dentist has suggested a guard to help their teeth, save their teeth from that grinding. But what I have found is that sometimes for some people, once they get a guard for their grinding, they start to clench onto that guard. So while it does save the health of their teeth, it is problematic for the musculature. So it can make that portion of it worse. So your pain level worse for the clicking and popping and that kind of thing. When we have somebody come in to the office, we check those two areas we just talked about, in through the jaw and above the ear. The other area that can be very tight when you are chronically clenching or grinding the teeth is the sternocleidomastoid muscle. It goes from behind the ear down to the sternum and the collarbone. So the SCM muscle. Often when people come in, I will be pulling on the sides of people's necks right up by their ear, and they're usually confused as to why we're doing that, but it will often be tight, sore all the way along down there. And it can really go hand in hand with jaw clenching or headaches as well. So we definitely always hit those main areas that first time because we're looking to see where the calcification is, where the problem spots at, and that is how we find it with shockwave. We're not always looking for calcification when we're using shockwave, but for TMJ and this issue, we are. So, how we treat TMJ currently in our office would be shockwave for all the different spots of the musculature that we can hit with that, the temporalis with the laser to help reduce the inflammation. We do some muscle work in the office as well with adjustments, and then we do at-home exercises. Once we tell people that they might be clenching, if we found tension in those certain areas, they often are surprised to find that they are clenching through the day. Some people aren't aware of their clenching. And then when you point it out and they come back the next week, maybe they have been a little more conscious of what they're doing throughout the day and they find that they actually are clenching throughout the day. That's a much easier fix. And it's just bringing it to your attention so that you can stop yourself throughout the day when you find yourself clenching. The trickier part is when you are clenching or grinding a lot while you're sleeping. Much harder habit to change. And usually it stems from stress. So we really try to reduce your stress level. We can't take away necessarily the stressful incident in your life or chronic thing that's happening in your life, but we can give you some tools to use to downregulate your nervous system and try to get it out of fight or flight right before you go to bed so that you're not clenching as much throughout the night. So it's a very multifaceted approach because there's a lot of factors that play into TMJ. And if we want to give you the most comprehensive and long-lasting results, it has to be multifaceted. So if you have any questions or if you're struggling with something similar, let us know.